pain causes more disability than cancer and heart disease combined.
That's unbelievable.
Yeah, it's unbelievable.
And they're very common here. Arthritis in
It's
particular
common
is
all over. One in
it?
every sixth individual has chronic or long-term pain.
You know, one hears a lot of discussion about pain management and whether it's ethical or not. And, you know, you also mentioned assisted suicide. There's issues about euthanasia. You know, is that moral or not? I need to make it very clear for the people watching as well that you're actually talking about pain as a disease and why, and like anything else, you don't have to suffer in this disease. This is not, we're not discussing assisted suicides and we're not discussing euthanasia over here. There's a marked difference.
Right. Actually, I'm saying we can prevent people asking for assisted suicide. We can, you know, make them so comfortable that they won't even think of euthanasia. Right? Give them quality of life, take away their pain, take away their nausea, vomiting, feeling of, you know, bad, although they know that, you know, in some cases that they're going to die. I mean, that's where the assisted suicide comes.
Absolutely.
If you give them good quality,
they won't
even think of it.
They won't even think of it.
Exactly, precisely.
You've been back in Pakistan for a few years now. What are the most common illnesses that you come across that need assisted pain management?
Right. Actually, I've been, you know, I decided almost a year ago that, you know, that I want to stay here and, you know, get things rolling. And
why? But that's another show altogether, Dr. Sajjad, but okay.
First of all, that, you know, there's awareness problem in pain, in any problem. People don't know where to go and seek help, if, you know, go to ENT doctor or stuff. Then there's a problem on both sides that, you know, some patients think that one doctor should treat all the problems. And some doctors try to treat all the problems. You know, if you see one patient 10 times a day, same thing, obviously you become much better in treating that disorder. If somebody tells me to treat my diabetes, it's not fair to patient if I'll start treating the diabetes. So I very nicely, politely ask them, you know, go to internal medicine doctor, an endocrinologist, or somebody who treats diabetes every day, 10 times a day. So first of all, people need to be aware that, you know, don't expect from doctors, a pain doctor, to treat your kidney stones. And the other thing is that people need to get aware, and that's, you know, part of medical community job, to guide them where to go, what to go, instead of just treating every patient by themselves. So, and they should, I mean, people tend not to, I mean, some patients do expect from me that, you know, just tell them, aapko 3 epidurals injection denge, and that's it. If you explain them, you know, you have a disc problem, pressing on your nerve, they're just not as interested. Take some interest, take some initiative, know what's your problem, then you can actually solve it better.
Yourself. With that, Dr. Sajjad, we do have to take a short commercial break. But you mentioned epidurals yourself, and a huge issue for any woman is labor pains as well. And we have an answer for that, as well as several other answers. Please join us again in the studio after the break. Welcome back from the break. Thank you so much for staying on the show with us. We're talking to Dr. Agha Sajjad, and it's really interesting because I'm getting my head around this, that this is, you know, an illness in itself, and you're saying it is very important for patients to be involved in their problem as well, और aware होना चाहिए एक patient को कि भाई अगर आपको तकलीफ है, किस हद तक तकलीफ है, दिन में किस वक्त शुरू होती है, किस चीज़ के बाद शुरू होती है. You know, you have to make a mental note yourself of what your problem is. I'm sure you get a lot of ignorant sort of patients coming in and saying, "आई दर्द हो रहा है, कब से शुरू हुआ पता नहीं, बहुत दिन हो गए, कहाँ हो रहा है, इधर हो रहा है, पता नहीं इधर भी हो रहा है." Does that happen a lot?
Oh yeah, actually, you know, they know I'm a pain specialist. You go to a wedding, or even sometimes just standing in a line on a grocery store, and you know, somebody I know meet, "Oh, you're a pain specialist. मेरे back पे pain हो रहा है, मैं क्या करूँ?" It's not an easy answer to that. You know, 3 साल से अगर pain हो रहा है, कोई एक injection नहीं है.
It's not a quick fix either.
It's not a quick fix. It could be they don't have to go through like a lot of treatment things or something like this. It may be in some patients a quick fix. मगर ये है कि you have to diagnose if it's a joint problem, if it's a disc problem, if it's a nerve problem. Like I do get a lot of patients in Pakistan from joint in the lower back, even below the spine. It's called the SI joint. It's not as such a part of spine. It's, you know, in the buttock.
It's like the tail.
On the side,
bone, yeah,
not even in the center, like here.
Yeah.
Okay.
Okay.
And they say that, you know, we have back pain for 3 years, right? And usually they have better chances, and they are suffering for a long time, not knowing what to do. In some cases, it could be a prolonged treatment. In others, it's not a prolonged treatment. Just one injection, some physiotherapy, some exercises and stuff, keep them pain-free for a very long time, if not forever. People, you know, just don't know. Coming to me or asking me, back pain hai, aap kya karenge? You know, let me just ask you a few questions, examine you, then I'll be able to. If it's low back pain, it can come from any source. So diagnosis is crucial. It's so much so crucial that back pain can come from what we call red flag symptoms.
Okay.
God forbid, it's very unlikely, but you know, cancer, infection, expanding the a blood vessel of your belly, aortic aneurysm we call it. उससे भी आ सकता है. So first time we see patients, we ask them 5-6 questions, examines them briefly to make sure that they don't have those problems. It's better to see any, you know, any primary care doctor or a pain specialist or anybody, get it checked. Maybe, God forbid, it's you know, if you have night sweats, if you have fever, God forbid, you know, it's common that we have TB of spine in our country. And actually not here, abroad, I was referred 2-3 patients who had back pain going down their leg. Typically, you know, sciatic pain, right? Yeah. And we do 3 epidurals. They are 80% are pain-free for a year or two. So, but you know, after examining them, I said, you don't have a nerve problem. The blood flow to their leg was decreased. They went for vascular surgery. The vessels were rearranged, right? And they did fine. The pain was gone. Their leg was fine. If I would have done 3 epidurals, probably it wouldn't have benefited them, but I would have just prolonged their agony. So diagnosis is very important.
Also, I couldn't agree more. My God, diagnosis is essential.
Right.
But the one thing that, the reason why I keep bringing labor pains into it is because I know a lot of women suffer.
Sure.
And there's a huge argument there as well. My God, I mean, I have a couple of friends who, I'm sorry, but you're ridiculous. I'm going to say that publicly, that they wanted to suffer. They wanted the natural birth. And I cannot understand that. I cannot fathom it, why anybody would want to go through that sort of excruciating pain. But you're saying that kind of pain can be managed as well.
Completely.
You don't have to suffer
for
actually,
hours. I've done for hours, not for even a minute, 5 minutes say. It takes 5 minutes to put an epidural in. There have been many studies, you know, does epidural prolong your labor? Does it cause any problems with the child?
Or
you
the
know,
spine.